Good afternoon, and welcome to the 7th Annual Conference of the Center on Poverty and Social Policy. I am Irv Garfinkel, the co-director of the Poverty Center. Center on Poverty and Social Policy produces cutting-edge research on understanding poverty and the role of social policy in reducing poverty and promoting opportunity, economic security, and individual and family well-being in New York City and the United States. The conference this year focuses on the intersection of race, poverty, and social policy. I have the privilege of introducing our opening keynote speaker, Cecilia Rouse, and then briefly engaging in conversation with her. Cecilia Elena Rouse was confirmed by the Senate on March 2nd, 2021, as the 30th chair of the Council of Economic Advisors, making her the first Black leader of the CEA in its 75-year history. In this role, she serves as President Biden's chief economist and a member of the cabinet. She is the Katzman East Ernst Professor in the Economics of Education and Professor of Economics and Public Affairs at Princeton University. Just prior to joining the Biden administration, Rouse served as the Dean of the Princeton School of Public and International Affairs. She joined the Princeton faculty in 1992 after earning her PhD in economics from Harvard University, where she also completed her undergraduate work. Her academic research has focused on the economics of education, including the benefits of community colleges and the impact of student loan debt, as well as discrimination and the forces that hold some Americans back in the economy. Chair Rouse, thank you so much for taking time out of your crammed schedule to address us this afternoon.
You're very welcome, Irv, and it's really a pleasure to speak here today and for you having invited me. The annual conference at the Center on Poverty and Social Policy is a really impressive gathering of so many who are really devoted to issues about poverty and equity. Researchers, agencies, nonprofits, foundations, and the media, you all contribute to these conversations in so many important ways. So over the past year, the COVID-19 pandemic has unleashed suffering around the world. As a global economy was powered down in order to minimize negative health impacts, an economic crisis was born that rivals the Great Depression. Governments have had to step in and to step up to help workers, families, and businesses get through to the other side of the crisis. As such, this pandemic has truly highlighted the important role that government plays in our societies. In the United States, as of April, we were still down 8 million jobs since February 2020. And it is clear there will not be complete economic recovery in this country, indeed around the world, until the virus is under control and people can feel safe, both as workers and consumers. The strategy of the Biden administration has been to first get to the other side of this pandemic. The American Rescue Plan, passed in March, is providing the resources necessary to distribute vaccines, provide relief to help people feed their families and stay in their homes, and to help viable businesses stay afloat and states and localities safely reopen schools. The ARP has been a jumpstart to our recovery. As you well know, the plan included a more generous, refundable child tax credit. Important research done by this center has shown that the ARP in its entirety cuts child poverty in half. But President Biden does not want to stop there. His American Jobs Plan and American Families Plan are prefaced on the idea that government is an important part of the innovative American landscape and needed where the private sector cannot or will not step in. Helping large numbers of people in need, building public space and services, and ensuring that both prosperity and burden are fairly shared. These are the hallmarks of these proposals. Both plans are historic public investments in traditional infrastructure and in the care economy, and in the people who provide and utilize all of it. I believe these investments will boost productivity and economic growth and produce a larger, more productive, and healthier workforce. But as I noted earlier, the burdens and benefits have to be shared by all. This has not been usually the case in America. Over the past 40 years, the wealthy have gotten wealthier, often on the backs of low-income neighborhoods and communities of color. This administration is committed to reversing that course. We at the CEA have an important role to play. We are in the business of interpreting data and helping the White House understand the economic ramifications of economic trends and proposed policies. But if we want to ensure that marginalized communities are attended to, we must make sure that when we analyze data, we do not stop at averages. We are committed to looking at a broad range of data in our work in order to unpack underlying and often baked-in discriminatory practices. When economists focus on average outcomes, instead of examining the range of outcomes, our analyses tell us about average economic growth and the middle of the distribution. But as our economy grows more and more unequal, that analysis fails to capture the experience of the many people who are left behind, particularly people of color. In both the policies proposed and in the analysis of their outcomes, our goal must be to create an economy that works for everyone, including and particularly the most vulnerable among us. Thank you.
So thank you very much, Cece. In your talk, you mentioned the need to go beyond the averages and examine the effects of policies on the most vulnerable and people of color. And since President Johnson's declaration of war on poverty, policy analyses in the US have included estimates of the effects on poverty. And more recently, some analysts have included increasing economic security, opportunity, and mobility as outcomes. I guess I'd like to hear your thoughts on the idea of adding reductions in racial gaps as an outcome. It sounds like maybe the council is doing this.
Well, thank you for the question. So I haven't thought about it specifically in terms of us understanding how it reduces the disparities for the following reason. Is disparities can be narrowed because you've brought up those who are at the bottom or because you've brought down those at the top. Now, granted, we certainly believe that the investments that we believe are important in infrastructure and human capital and innovation that we believe are really important for the U.S. economy to continue growing, the investments that are, those are going to cost a lot. We want those investments, the benefits of those investments to be widely shared. And we believe that those at the top should be helping. So we want to narrow income gaps. There's no question about that. And we want to be mindful as we're doing that we're including everybody in those gaps. So if that's the extent to which you're asking the question, I would say, yes, that's a fair point. So, we believe that income inequality, wealth inequality has been widening in the United States, and that's not a helpful trend. Not only, I think, are there economic ramifications, but I also worry very much about the impact on our democracy, which, arguably could, I think many of us would argue, is worth preserving.
Right. So actually, our center we have added the looking at racial gaps as an outcome. And it's not that we didn't look at different effects by race and ethnic group before, but we didn't do it systematically. And we're now doing it systematically. And I think for us, that's a step forward.
So, Irv, I would say that what we are trying to do is to look at impacts by race, ethnicity, geographic parts of the country. So we are trying to examine, as we develop policies, how do we want to ensure, if we're doing training programs, how do we want to ensure that those opportunities are not just, okay, with all due respect, centered in New York City or in other, places which have been magnets to many forms of investment, but to ensure that they're getting to other neighborhoods. We could even talk about the Mississippi Delta or other places where investments haven't traditionally been emphasized, sometimes because it's harder to organize providers and others, or because we're just not really focusing on it and making a big effort to do so. So we want to look at impacts for different subgroups so that we can understand and ensure that we are really making sure that these investments are widely shared.
Yeah, it's interesting. I think the data, some groups are easier to look at than other groups. Small groups, obviously the most difficult in terms of data. And here, when you talked about the Mississippi Delta, I thought about also Native American reservations, and our data there is scant.
So that is one of that's one of the efforts the CEA is trying to contribute to, is talking to our various federal statistical agencies. How much money would you need in order to improve sample sizes for some of these smaller populations so that we can learn more about them? They gather data now, but as you point out, the cell sizes are very small. So even if you could look at them, they'd be very variable, but also then you get into issues of privacy. So they won't even release those data. So if we could increase the sample sizes, I think it would allow us to have a more fulsome picture of what is actually happening in some of these communities.
Great. Well, that's very good news. Thank you. So I know that your research has been seminal on college, community colleges. And I just thought, given that, I can't pass up the opportunity to ask you to expand. I know it's near and dear to your heart, and so anything you have to say about the administration's plans, the rationale, what's happening?
Sure. So absolutely. I actually believe that community colleges are part of what make our higher education system one of the best in the world, because in many other countries, students have to be on a path, on a track, in order to participate in their best in the higher education system. Whereas in the United States, we have a bit more of an open door. We give students a second chance. And I think that flexibility, it comes with cost. There's no question about that. But I think it has a lot of benefit and upside as well. And so the administration is actually trying to invest in human capital across the range. So there is the universal pre-K and investments in childcare, so that our youngest are getting the benefit of the very high quality interventions and education and environments at the very youngest ages. And that this crowd all knows that kind of investment pays for itself a few times over. But that also has to continue past just grade 12. And we understand that in today's economy, people need more than 12 years of education. So community colleges are the first door of that. The administration has, in addition to trying to help states lower the cost of tuition, which is what the free community college effort is really about, is recognizing that state investments in community colleges, in four-year colleges, have decreased over time, and to give them some funding to try to keep the state subsidy robust, so that the tuition costs aren't just passed on to families, which is why we've been seeing increases in tuition, or one of the major reasons why we're seeing increases in tuition. But this administration isn't just about only 2 years; it's saying at least 2 years. There have been we've proposed increases in the Pell Grants and the maximum Pell Grant, made investments in historically Black colleges and institutions, HBCUs, historically Black colleges, universities, minority serving institutions, tribal colleges. So what's really important is that we invest in our people, because we know that, especially if we're going to deal with existential crises such as climate change, we need to have all the best and brightest. We need all hands on deck, and we need to make sure that our students have the opportunities to get the kinds of education that they need to really be able to compete in the economy.
What's your sense of the support? Is there any bipartisan support for community colleges?
What Irv hasn't neglected to say is this is my third tour. It's been very interesting to me to watch the support, not just even Democratic presidents, but Republican presidents as well, are very supportive of community colleges in particular. They're in almost every neighborhood. I think we recently calculated, I'm going to get the number wrong. Wait, we have an issue brief coming out. I think 90% of the population lives within 30 miles or so of a community college. They're in almost every neighborhood. Again, they're open door institutions. You need to have a high school degree, or if you don't have a high school degree, you can demonstrate an ability to benefit and to enroll. We know that they take the traditional student. They take students who are a little bit older. They've got flexible scheduling. They do both traditional academic education and more vocational kinds of education. So they really are community colleges. And so policymakers see them as the foot in the door, how we get a foothold in getting more students access to post-secondary education. So I do think that they have bipartisan support, but as you know, in Washington, the devil's always in the details, and the partisan politics get wrapped up. But the president is committed to trying to get both of his plans passed in a bipartisan fashion, and he would importantly note that the American Jobs Plan, the American Families Plan have over 50% of Americans support it, and that's among Republicans and Democrats. So there's bipartisan support among the people. Washington, we will see. We hope.
Well, I want to thank you again for opening our conference, and it's reducing poverty and racial gaps is hard, ongoing, and intimately related work. So thank you, Cece.
You're very welcome. And I wish you the best. I'm sorry I can't stay for the rest of your conference.
Appreciate it. So I want to introduce my co-director, Chris Weimer, who will host the remainder of the conference today.
Great. Thank you, Irv, and thank you to Dr. Rouse for sharing your comments and also your time today. And just to welcome everybody again today. The Center on Poverty and Social Policy, as many of you may know, is focused on producing actionable and policy relevant research to the extent all possible. And today's theme is race, poverty, and social policy, which reflects our commitment to making issues of racial and ethnic inequality more central to our work. And what this means to us so far is, from a policy perspective, is that the goal can't just be to reduce poverty across the board, that we also have to pay close attention to long-standing and persistent gaps in poverty across racial and ethnic groups. So we know policy has been central to bringing poverty down over time, but these gaps have remained quite large and persistent, as we'll talk about in the panel coming up. And I guess the other theme that sort of cuts across some of the research today is that COVID has happened over the past year. And just like with COVID's effects on health and mortality, the virus has not been race blind with its economic impacts either. And so the research panel today will hone in on issues of race, poverty, and social policy, and also how that's played out with COVID over the past year. And the way that we're going to structure things is we have a research panel next. First up in that research panel will be Kaylin Washington and Michael Williams, who are both part of our Poverty Tracker team, Poverty Tracker being our longstanding partnership with Robin Hood in New York City to track dynamics of poverty, hardship, and well-being in the city. From there, we'll turn to Megan Curran, who will share some of our work that's funded by the JPB Foundation, the Bill and Melinda Gates Foundation, Annie Casey Foundation, tracking poverty through the COVID crisis, as well as the policy responses, which have been numerous and quite important over the crisis. And then we'll turn to Rebecca Charles, who will look at our existing portfolio of anti-poverty policies and the ways that they do and do not contribute to meaningful reductions in racial and ethnic gaps in poverty. Following that, we'll have a Q&A. So people should feel free to put in their questions for the panelists in the Q&A box. We're in webinar mode, so I will administer the questions or read the questions for the panelists during the Q&A session. And then from there, I'll turn it over to Professor Ron Mincy, who will introduce our final keynote speaker, Bradley Hardy, who we're lucky enough to have here with us today. And then there'll be another brief Q&A following Dr. Hardy's remarks. So with that, I will just thank you again all for coming, and I will turn it over to Kaylin and Michael.
Good afternoon, everyone, and thank you, Chris, for that introduction. Today, we're going to talk about the impacts of COVID-19 through the lens of racial and ethnic disparities. I'll talk about how we gathered the data and some of our initial findings from COVID-19, and then Michael is going to talk about some of our findings from a more comprehensive survey that's solely focused on COVID-19. So to get started, I'm going to talk about how we gathered the data. The Poverty Tracker is a dynamic tool that we've been using since 2012 in partnership with Robinhood to help capture the quality of life for New Yorkers and really gauge how New Yorkers are doing. A benefit of this tool is that we can be on the forefront of impactful events and policy changes that affects lives in this city. For example, when paid sick leave laws were passed in New York City, we were able to quickly ask our participants questions about it and gather data on how people were affected by this law. I say this just to highlight how dynamic the Poverty Tracker can be in showing and illustrating impacts on people's lives, and even having the ability to do so in the case of unforeseen events like COVID-19. Because of the tracker, we were able to gather data and highlight some significant impacts relatively quickly. Like I mentioned earlier, I'm going to talk about this rapid response module that we launched in March of 2020 and go over how we put that together and some of those results. And then Michael will go over the COVID standalone survey launched in September of 2020. So when COVID-19 hit, we had to quickly change our whole way of operating in a matter of days to function with everyone working from home while still maintaining data security and keeping the study moving. Around this time in March of 2020, we were about to launch a survey that focuses on assets and debts. And we saw this as an opportunity to add this COVID response module to capture the initial impacts of COVID-19 on employment and finances, really honing in on the loss of work, essential work, loss of income, and the need and receipt of benefits. So now I'm going to go over some of those results from the rapid response module. Now, prior to the pandemic, there were already stark racial and ethnic disparities that we found, and we found in these initial results is that COVID exacerbated these severe levels of inequality. As you can see here, roughly 31% of Black workers continue to work on site at the peak of the COVID-19 outbreak, which is twice the rate of Latino workers and 3 times the rate of white workers. Workers of color are overrepresented among low-wage workers, and the data show that 55% of Black workers and 59% of Latino workers lost employment income because of COVID-19, compared to the 43% of white workers. Black and Latino New Yorkers who later lost employment income were more likely to be in poverty or to be low income compared to white New Yorkers who eventually lost employment income. And at the height of the COVID-19 outbreak, roughly 70% of Black and Latino New Yorkers who lost employment income worried that they would run out of food before the end of the month because they didn't have enough money to buy more. Comparatively, that's roughly to the 33% of white New Yorkers who lost employment income or faced the same hardship. So these are just some of the findings that we gathered from the initial impacts of COVID-19, really highlighting the racial and ethnic disparities that this pandemic exacerbated, in particular when it comes to the impacts on employment and income. Like I mentioned earlier, we did launch a more comprehensive survey that was solely dedicated to the impacts of COVID-19 in September of 2020, and Michael's now going to go over some of those results.
So thank you, Kaylin. As Kaylin just mentioned, our more comprehensive survey is our COVID-19 standalone survey. It primarily focused on the 4 areas listed on this slide, just to get a more detailed look at how New Yorkers were faring with the pandemic. The first area of focus, financial security and spending, looked at changing spending habits. Workers who lost employment income, a group where people of color were overrepresented, were more likely to use their savings, use their credit cards more frequently, and delay payments on those cards and on other loans. Each of these actions might have been necessary for surviving the pandemic. However, income loss in combination with lower savings and increased debt will weaken the future financial stability of these New Yorkers. The pandemic also directly impacted housing security. Housing security, as we all know, is an issue that New York City has long struggled with. Before the pandemic, 1 in 5 renters were unable to pay their rent. The pandemic increased this figure to 1 in 4 renters. This is particularly troubling because from our data, we see that New Yorkers are not confident in their ability to maintain their future rent payments. In our sample, roughly 2 in 5 renters are only somewhat or not at all confident that they'll make their next rent payment on time. When we look by race and ethnicity, we see that around 1 in 2 Black and Latino renters in our sample are only somewhat or not at all confident that they'll make their next rent payment on time. This is roughly twice the rate that we see for white renters in our sample. And so while housing security as an issue is becoming worse, existing racial inequalities mean that people of color are going to be the ones most affected. Just like housing security, New York City has long struggled with food hardship. Before the pandemic, roughly 1/3 of New Yorkers experienced food hardship. Once federal relief programs began to expire in the fall of 2020, rates of food hardship rose to 42%. Once again, when we look by race and ethnicity, we see a troubling disparity. Roughly 1 in 2 Black and Latino New Yorkers experience food hardship. This is roughly 3 times the rate of food hardship that we see from white New Yorkers in our sample. And so while the pandemic is increasing issues of food hardship, it's also threatening to widen already existing racial and ethnic disparities in food access. The pandemic has also highlighted existing disparities in internet access. Roughly 1 in 5 New Yorkers surveyed do not have a computer with internet access. If we look at the map on the right, we see that these New Yorkers are most likely to live in the Bronx or Brooklyn, 2 boroughs with high populations of people of color. Ultimately, this speaks to unequal investment in digital infrastructure in communities of color. Nearly 1 in 4 Black and Latino New Yorkers in our sample don't have a computer that has internet access. This is compared to roughly 1 in 8 white New Yorkers. So here we see that Black and Latino New Yorkers in our sample are twice as likely to not have a computer with internet access when compared to their white counterparts. This is particularly troubling when we consider the important role that remote learning has played over the past year. Discrepancies in internet access have the potential to widen already troubling gaps in academic achievement. Overall, the pandemic has exacerbated existing racial and ethnic disparities in New York City. The data outlined in this presentation should inform discussions about policies that can address the short-run and long-term effects of this crisis. In addition, policy needs to address the underlying inequalities that have led to New Yorkers of color bearing the brunt of every negative outcome of this pandemic. And with that, I'd like to say thank you and now pass things over to Megan.
Hi, thank you so much. I'm going to take a step back slightly here and just talk a little bit more about what we've been finding in terms of poverty and also the impact of poverty at the national level through the pandemic. So this has also been based on work that's been conducted in partnership with a number of my colleagues listed here. So a quick note on measurements. When we're talking about poverty, the traditional way that we measure it is usually after the full year is done. So there tends to be a considerable lag in terms of when we have the data and what that means in terms of informing decisions. That is imperfect in normal times, but everyone knows by now that 2020 and what has been 2021 so far is really clearly far from normal. So this was something that called for new tools. And 2 of the pieces that I'm going to talk about here today, a lot of this work was spearheaded by my wonderful colleague, Zachary Parolin. And I like to think of them as two tools that are really designed to meet the times. So the first is a way that we have been forecasting monthly poverty rates. So last year in particular, from things ranging from the lockdowns to job loss, to the different bits and pieces of federal aid that came in at crucial times, but also was allowed to expire at other times. How a family or an individual was faring really depended on what month we're talking about. We've also been trying to look at projecting what annual poverty rates look like in the near future. So we've been in the middle of huge policy changes. There have been large packages moving through Congress, in both the sort of scale and speed of which we have not seen in any sort of recent time. And so it's been really important to try and get a sense of their impact and what that really means in terms of poverty in this year and next. So to look quickly first at what we've been doing in terms of monthly poverty, the images here essentially chart two different paths. And the story that they tell is essentially that policy, public policy matters. So the dark blue line looks at what monthly poverty rates for children in the US would have looked like through the course of 2020 had essentially the pandemic happened, but the federal government not stepped in the way that they did. We see, that there would have been a huge spike in April, just after things hit in mid-March. And we would have seen that these rates would have stayed elevated for much of the year. So a quick note that you'll see in the sort of dips in March 2020 and March 2021, because we're looking at poverty here on a monthly basis, these represent times when families with low and moderate incomes would have received a large portion of their earned income tax credit or child tax credit refunds. And so these are large sort of one-time payments that really kind of represent anomalies in sort of family income over the year. So if you kind of take those out of your vision, you can really see a clearer distinction between the rest of the months of the year. The lighter blue is essentially what did happen to child poverty rates because the federal government did take action. And so we see that amidst the worst of the crisis, we seem to have managed to hold child poverty relatively at bay. Now, you can see through some of the arrows that, there were increases or dips in poverty that corresponded with key times that big policies were enacted or when big policies were allowed to expire. But percentages are not people, right? And so Jason DeParle, reporter with the New York Times who covers poverty and families, covered really well and pointed out in the newspaper last year that something like this monthly view lets you actually see a story of what happens to families' fortunes as they sort of rise and fall with policy changes. And, he talked about the fact that from our data, he was able to see that 8 million more people were in poverty in the US in the fall of 2020 than were in poverty in the spring of 2020. Even though the spring of 2020 was the sort of height of the unemployment crisis, and, the lockdowns were much harsher. But essentially, that is also when we had the strongest pieces of policies in place. When they ran out, poverty rose again. We've also been able to have the ability to try and track some of these monthly trends by race and ethnicity. Obviously, the first thing that you see here is that, the disparities and gaps that, have been mentioned earlier, still play out here on the monthly level. You can also see some trends that, the yellow line here representing Latino families is somewhat higher, especially in some of these months where the rest of the CARES Act, sort of stimulus checks and unemployment pieces were in place. But immigrant families were left out of a lot of these provisions. And so you can see that in the higher elevated poverty rates in some communities. So, policy is good, but access is key. The last two pieces that I'll talk about is moving to our forward-looking projections. So much has been written about in terms of the American Rescue Plan. So this was the large action taken after President Biden took office. And we were pleased to be able to do some early analysis, looking at the potential impacts of this big package. You can see on the right-hand side a set of the key income supports that we took a look at. And the top line figure has really been that, if everyone is able to access, these key elements, child poverty could potentially be reduced by close to half in 2021, this year. Much of this is driven by the new child tax credit, but it's really important to note that these figures represent poverty reduction potential. They're the results of what could happen if all those who are eligible do actually receive it, do receive the new child tax credit, do receive their stimulus payments, continue to receive their unemployment benefits that they're eligible for, and things like that. So many folks across the country at all different levels are working hard on these access pieces, but they are the ones that really determine the end results. I'm happy to cover some of that in the questions. We also now have seen, most recently, President Biden announce his proposal for longer-term economic recovery. And so that has been termed the American Families Plan. And crucially, among a number of provisions, again, listed on the right-hand side, the new child tax credit would be continued for a number of years. We find three main takeaways from looking at this plan in the lens of poverty and poverty reduction. The first is that without something like the American Families Plan, poverty would, quickly rise back to what it's been pre-pandemic. So these gray bars here represent what 2022 could look like if we don't continue any of these important improvements. The American Rescue Plan is great, but it's temporary. The second piece is that the American Families Plan, though, in and of itself, can make a big difference. We see, again, for children in particular, that it can potentially keep child poverty, essentially halved. And what this actually means is just continuing the progress that we could make this year. And the third piece is that it really has the potential to make a big difference across communities. So this chart here is looking at, potential child poverty rates in 2022, both with and without the American Families Plan. You can see that across communities, it's making substantial potential reductions, and this translates to millions and millions of children whose incomes would rise, and hopefully their chances for educational opportunity, good healthy outcomes, and things like that would be improved. This is huge for the U.S. It's not how we tend to operate, and that's something that should be celebrated and continued. But it's also important to be realistic that it's not a silver bullet. We're not eradicating child poverty altogether here. And we're also not eradicating the higher risk and experience of poverty that Black and Latino children would continue to face. So you can see even with the blue bars that the risk of poverty here remains higher than some of their white peers. So it's important to qualify all of these types of analysis that top line figures like this can be really informative, and especially when you're doing it in something in real time when policy is changing quickly, as is the economy. But these top line figures are also just one part of the story. So when we're talking about gaps and inequities, there is much more nuance to it. And so to actually, on that note, I'm going to pass it now to my colleague, Rebecca. She's been drilling down a lot more on this, and she will take you into a bit more of a detailed discussion on some of these gaps.
I'll be presenting our analysis on the role of government transfers in reducing the Black-white child poverty gap. So today, Black children are nearly 3 times more likely to grow up in poverty than white children. This presentation will focus on the Black-white child poverty gap, which, like most racial inequalities, is a vestige of slavery and over a century of systemic racism. We know that throughout slavery and Jim Crow, Black people were not seen as people and were unable to build wealth. But what happened when social welfare programs began being implemented in the US? Well, they primarily benefited white households and 2-parent households. While policies today are not as blatantly discriminatory, racial disparities still persist in regards to who is benefiting from them. Child poverty overall is on the decline, but the Black-white child poverty gap remains. Here we examine how government transfers affect, how well government transfers are reducing the Black-white child poverty gap. In today's presentation, we're going to be discussing the measures of poverty and income we use in this analysis, how government transfers impact the income gap between Black and white children in terms of the income to needs ratio, the poverty gap, and the poverty rate, as well as effects of in-kind transfers versus cash transfers and tax credits. So here are the three measures of poverty and income we examined and what they mean. So for all of these measures, we use the supplemental poverty measure, which takes into effect in-kind transfers and post-tax income. So we have the poverty rate, which is our most well-known form of measurement of poverty. So we have that conveys the percentage of children living in poverty each year. Then we have the poverty gap, which indicates the difference between the poverty threshold and the total income of a family living in poverty. And then we have the income to needs ratio, which expresses the relationship between family income and the poverty threshold. It's calculated by taking a family's income and dividing that by the poverty threshold. So just as a visual, take for example, this 2-parent, 2-child home. We have 4 people, and hypothetically speaking, their poverty threshold is $25,000. Let's say their annual income is $18,000. So right off the bat, we know that this family's status is considered in poverty because they make less than the poverty threshold. But let's look at their poverty gap, which would be 25,000 minus 18,000, and that's 7,000, and then per person, 1,750. And then the income to needs ratio for this family is 18,000 divided by 25,000, which is 72%. So while the poverty rate is the most common form of common measure of poverty, these two measures can really convey the depth of poverty that we're looking at. Here are the policies that we examined in this analysis. I categorized them by in-kind benefits and cash transfers and tax credits. Well, I'll get into that a little bit later. These results were all from pre-COVID data, so our findings really paint a picture of the impacts of these policies in about 2018. So we start by examining the effects of government transfers on the income to needs ratios for Black and white children in poverty. And I want to stress that we were only analyzing children who were already in poverty. As a reminder, the higher the percentage, the closer a group is to the threshold and being out of poverty. So before accounting for transfers, you can see that the income to needs ratio for white children is 5 percentage points higher than that for Black children. And after all transfers, the income to needs ratio for Black and white children are equal. But overall, in-kind transfers like SNAP are more beneficial to Black children, and cash and tax transfers are more beneficial to white children. Later, we'll discuss this trend and its implications a bit further. So let's look at the policies individually. Speaking to the trend of in-kind transfers and cash transfers impacting different racial groups differently, here we see that the disparities between in-kind transfers and cash transfers are largely driven by housing subsidies and Social Security. Housing subsidies increase the income to needs ratio for Black children by 25%, while Social Security increases the income to needs ratio for white children by 35.6%. Now moving on to the poverty gap, which tells us the dollar amount needed to reach the poverty threshold. Once again, we see the benefit of in-kind transfers to Black children in poverty and cash and tax transfers for white children in poverty. Overall, transfers work significantly to reduce these poverty gaps, bringing the gap for Black children from 4,024 to 1,336, and the gap for white children from 3,614 to 1,508. Note that the gap is largely equal after transfers, but the way that the SPM treats out-of-pocket medical expenses is playing a role here. So far, our analyses of the income to needs ratio and the poverty gap show that policies do a good job of equalizing income for Black and white children in poverty. However, before and after transfers, Black children are nearly 3 times as likely to be in poverty than white children, and transfers do not narrow this gap. Here we examine the effects of transfers on poverty rates and the Black-white child poverty gap. Before government transfers, 46% of Black children living in the US are living in poverty. That is 2.71 times the poverty rate of white children at 17%. After in-kind transfers, the gap is decreased to 2.57%. But then if we instead add cash and tax transfers instead of in-kind transfers, the discrepancy is wider than the original at 3.18, really reiterating how much white children disproportionately benefit from those types of transfers. And after accounting for all transfers, the Black-white child poverty gap is 2.86, revealing that government transfers as a whole do not close the poverty gap between Black and white children, and even slightly exacerbate it. So as seen throughout this presentation, in-kind transfers and cash transfers benefit different racial groups in different ways. Across all measures of poverty, in-kind transfers benefit Black children more than white children, and cash and tax transfers benefit white children more than Black children. In-kind benefits do serve a specific need, such as food or shelter, but there is a deeper discussion to be had regarding paternalism at play in the making of these policies. In summary, government transfers equalize the income to needs ratios of Black and white children in poverty, though the gains are modest, but did nothing to decrease the Black-white child poverty gap. After government transfers, Black children are nearly 3 times more likely to be in poverty than white children. And finally, cash transfers and tax credits, such as Social Security, are disproportionately beneficial to white children. In conclusion, it is evident that government transfers play a major role in reducing child poverty. However, if racial justice is a priority in social policy, thinking about how we narrow this gap should be a key focus moving forward. Thank you.
Great. Thank you, Rebecca, and thank you to the whole panel. I actually ask all the panelists to turn their video on, and we'll start some Q&A. And yeah, so the first question actually is kind of logistical. It's a question for the poverty tracker about whether we're repeating the COVID module in the subsequent rounds of the poverty tracker. And maybe I'll just use that as an excuse to give a plug for the data, because one thing I forgot to mention in the setup is that we have released publicly the poverty tracker data, and Michael's last slide, there's the web address for that. But if you go to povertycenter.columbia.edu, and you can click on the data section, and we've just made part of the second panel, which we followed for about 4 years from 2015 to 2019, available for download and use. And we encourage people to go analyze that data. And I raised that just because while we don't plan to repeat the COVID standalone survey that Michael analyzed, or the rapid response module that Kaylin talked about, we do have a lot of information about the impacts of COVID for that sample that we finished following right before COVID hit. So I'll start actually with a question for the poverty tracker team, Kaylin and Michael. So the question is, I really appreciated Dr. Rouse's focus on the most disadvantaged. How well do our data in New York City and nationally capture the most disadvantaged? What groups are missing, and what might we be able to do to better capture them?
Okay, I can talk a little bit about that. So as far as capturing the disadvantaged in New York City, so we can go into the poverty tracker data and just kind of extrapolate and just sort of see data based on poverty status, just how close you are to the poverty threshold. So that's something that we do commonly with just analyzing data. And so it's New York City focused. And yeah, so I can speak to that. I'm not sure if Chris or Kaylin have any other thoughts.
Yeah, I mean, just a couple other thoughts on the poverty tracker data specifically is we, this year also for the first time, we've added an oversample of people from Chinese origin in New York City, and also introduced the capacity to be doing surveys in Mandarin. So that's going to expand our capability to look at Asian American New Yorkers and Chinese origin New Yorkers in New York City, which we historically haven't been able to do. And then Kaylin, I don't know if you wanted to say a few words maybe about the early childhood poverty tracker as well.
Yeah. So I think as COVID continues and like goes on, there's a lot of data that we can like continue to capture. And one of the things that we did do was add some questions about COVID to our early childhood poverty tracker, questions that involve women and children to try to gather more data about that and households and parents with children, things like that. And I think as the situation evolves, we're going to be adding more information about, we're going to get more information about kind of who is affected and how people have been affected kind of long term as well.
Thanks, Kaylin. So the next question is, there seems to be a disproportionate impact of COVID on women, particularly women of color. Do we have any research on that? So maybe I'll pass that to Megan.
Sure. That's a really good question. I don't have any particular breakouts by gender to hand, but I can imagine based on the trends that we were seeing, breaking out in different ways by age and then also by race, it's quite likely that we would see poverty among women during COVID consistently at higher rates than poverty among men, but then within that, you'd also again most likely see the differential impacts with the poverty rates are going to look different for Black women versus for white women and things like that. That's true in normal times, and things have people have links to long-term structural issues, but were very much exacerbated during the current crisis. I think elements of pieces like the CARES Act last year, the American Rescue Plan this year with all of the income supports, if they reached families, they made a huge deal. And we know earlier efforts, something like paid leave would be particularly important for women, housing assistance, just so in general. But moving forward, a lot of the emphasis recently with the American Families Plan, rightly so, there's been a lot of attention on the childcare, proposals. Care is definitely not only a women's issue, and it's not the only women's issue, but it is, a clear one. And I think the pandemic has thrown a spotlight here on just the disproportionate impacts of what happens when care infrastructure is not in place. Women bear the brunt of it, even though it's a family issue. And so I'll throw a link in the chat afterwards, but our colleague, Rob Hartley at CPSP, he released a recent report looking at what affordable childcare, similar to some of the proposals that are in the American Families Plan and also introduced by others, could do, not just for sort of women's income, which is what poverty would measure in the short term, but actually their lifetime earnings, because when things like this is not in place, it impacts the ability of women to be able to work and earn money now. It also impacts the long-term impacts of them being able to save for things like retirement and things like that. And so I think that, we should actually probably pay more attention to some of these gender pieces in our top line reporting. And that's something that we can incorporate into our work moving forward. And it's a really good thing to point out. But I think also it's important for us to keep an eye on some of the policies too that are crucial, not to just income in the short term, but longer term recovery.
So Chris, may I make a comment on this?
Sure.
So Cynthia, who's one of my member of my class, there's also been some national data suggesting that mortality rates vary by gender, particularly among people of color. And they vary in a way that is non-traditional. The mortality rates in the United States, we're not collecting and reporting data on the gender consequences of COVID, but it appears that in many other countries, particularly where you have low-income men, the rates of mortality are much higher for men than they are for women. And so this entire discussion about the gender consequences, at CPRC, we've talked a bit about if there are ways of analyzing the data that we're collecting to look at the gender consequences of the health and mortality. And it's an important question to raise, but I think the full spectrum of not just the employment rates, but also the mortality rates, having to do with differential health outcomes for people of color, men and women in particular.
Thank you. We have a couple questions for Rebecca that I'll try to sort of merge into one question. And so the first one is, do we know why cash transfer, they're related. Do we know why cash transfers do less to reduce Black poverty than white poverty? Is it differential eligibility or take up or both? And a related question is, do we think that this difference between in-kind and cash transfers is based in any sort of racial bias in how states distribute these funds? And the person posing the question raises a colleague of ours, Dr. Carolyn's work on the TANF program and how states with higher proportions of Black residents spend less on cash assistance in TANF, et cetera. So any part of that you want to take, Rebecca?
Yeah, so there's a lot of, if you look at what cash and tax credits, cash transfers and tax credit programs are, and you look at what in-kind programs are, you can see that, like I mentioned in the presentation, in-kind benefits typically serve a need, such as food or housing. And so one explanation could be that Black people in this country tend to be in deeper poverty than white people, and so they are taking up those in-kind benefits more so than the white population. But there's also a lot of eligibility at play. And as far as the other questions pertaining to state eligibility, we are actually looking, Megan and I and a few of our other colleagues are actually doing a report on looking at racialization within social policy as far as like eligibility and people who are conditionality, and looking at trying to create a rubric as far as determining racism within policy. So be on the lookout for that report coming out. But yes, there's a lot to say as far as in-kind transfers versus cash transfers. And as I mentioned, also paternalism is another explanation, just the idea that the government wants to do what's best for people who need these benefits. But there's a lot of different theories that we could go on about.
Thank you, Rebecca, and thank you to the whole panel. There's a whole lot more questions in the Q&A, which are great, but unfortunately there's no more minutes for us to do them. So with that, I'll just thank everybody on the panel, and we'll save the chat and hopefully be able to address some of these questions behind the scenes in the coming days. And with that, I want to turn it over to Dr. Ron Mincy, who is the Maurice V. Russell Professor of Social Policy and Social Work Practice here at the School of Social Work, who will introduce Dr. Hardy. So over to you, Ron.
Good afternoon, everyone. It's my privilege to introduce Professor Bradley Hardy, who's the Associate Professor and Chair of the Department of Public Administration and Policy at American University and a non-resident Senior Fellow in Economic Studies at Brookings Institute. Dr. Hardy's research focuses on labor economics. He especially is interested in economic instability, intergenerational mobility, anti-poverty policy, racial and economic inequality, and socioeconomic outcomes. His work examines trends in the sources of income volatility, intergenerational mobility in the US, with a focus on socially, economically disadvantaged families, neighborhoods, and regions. He also conducts research on the role of transfer programs, particularly SNAP, the Earned Income Tax Credit, TANF, for improving the well-being among low-income individuals and families. He's a co-editor of Contemporary Economic Policy and the Journal of Policy Analysis and Management, and serves on the executive board of the Association of Public Policy Analysis and Management, and he's an elected member of the National Academy of Social Insurance. Bradley, thank you so much for taking time to join us, and we look forward to your talk. You got it.
Ron, thanks. And, I just want to thank the entire team at CPSP for allowing me to join you all today. And, frankly, I think a lot of the work that I'm presenting right now that is joint with Sandy Darity, Derek Hamilton, and Jonathan Morduck, really, I think it dovetails nicely with the CPSP presentations you've heard so far. And so we want to take a deeper look at some of the measures we can use to better understand economic conditions among minority communities, with an emphasis on Black families. though this does extend to other underrepresented groups as well. So, just as an overview, this audience fully understands that there are large income and wealth gaps, and that as other presenters have noted, these gaps have persisted over time. There is a very clear historical and persistent policy legacy that has driven these income and wealth racial gaps. But importantly, and this actually highlights the importance of within your measures of poverty and inequality, importantly, we know that economically disadvantaged groups, and in particular Black Americans, also exhibit higher levels of income volatility. And this really does, just broadly speaking, get at this notion of episodic poverty, of episodes of economic insecurity that occur, frankly, not just within the year, but within the month. And so, we're contributing to a large body of work that has backed this up, that shows, for example, that you'll see large changes in caloric intake that are timed along with the receipt of food assistance benefits, showing that families are having to switch consumption within the month as resources vary. And so, these are conditions that were, occurring for these households and families disproportionately prior to COVID-19, and that left many of these households just that much worse prepared to withstand the economic shock of COVID-19. And so clearly, this audience and the scholars and CPSP know and have documented that there's all sorts of important social welfare policy design implications, and frankly, many of which you've now heard about directly. And so just to kind of quickly motivate what we're talking about here, by many accounts, depending on the survey data set you utilize, and my co-authors and I are drawing data from the panel study of income dynamics. This follows families over time from about the 1960s and tracks their economic conditions. Well, essentially we know from this figure that in general, the typical Black family, if you compare to the white family, has roughly half the income level. Now there's different ways to cut this. And certainly if you were to further stratify on factors like education attainment, perhaps you can get a narrowing of these income gaps. But just that unadjusted income gap, depending on the data set, you can find that it's roughly half. Black families have half the income on average of white families. If we further extend this to thinking about wealth gaps, and this has been more discussed recently, that historic factors, intergenerational transfers, policy factors that have prohibited educational attainment, the building up of Black businesses, the passing on of wealth across generations, home ownership gaps. Well, what this amounts to are Black-white wealth ratios such that, Black families have not even 20% of the wealth of white families on average. But, the bottom line for our research team was that amid this, and you can think about income and wealth gaps that are stark, part of the reason why it matters is that we find that Black families are more exposed to so-called income volatility. And so this is really the only measure where Black families have a higher level, and that's not qualitatively a good thing, right? And so what we're talking about here then is that for Black households, incomes are lower, wealth is lower, but those incomes are also more unstable. And, in many respects, you could think about that as being sort of the worst possible portfolio that you'd want. Now, if you were to think about kind of a taxonomy of where we'd want our families, and, human service workers, social workers, policy analysts are really concerned about this, income and wealth really do provide protection against the unpredictable events that can occur within one's life and in the life of your family. And so many of our Black households disproportionately find themselves kind of in this lower left-hand corner where they're struggling because they both don't have the protection of income and wealth, and those incomes are far more precarious, unpredictable. And so, there's a great social sciences body of evidence that tries to think through what's going on here. Hours volatility, many of our families who are employed in situations where wages are lower, they also have employers who will vary up the hours and days that they work. Many of these households are attempting to work, but do find themselves in and out of employment at a far higher rate. And so these sorts of jobless spells do create this sort of economic risk and volatility. And again, it's just worthwhile emphasizing sometimes the discussion of implementing monthly poverty, depending on where you come at this, it could seem sort of wonkish and maybe even like, metaphorical inside baseball. But really what it gets at is the idea that we have to certainly pair our yearly measures of poverty and well-being with these within-year measures. That we know that within the year, on the plus side, you might receive a very generous earned income credit and maybe things are relatively better. But on the other hand, if things are lean in a particular month or week, we'd like to have a better approximation. And so, we think that this sort of research is in line with all sorts of fantastic interview data and qualitative evidence about how families are trying to make ends meet within the month, within the year. Now, in work that's in progress with Charles Hokeam at the US Census Bureau and Stephen Roll at WashU in St. Louis, we're trying to document racial and ethnic gaps in all sorts of economic outcomes. Here, this is just a quick snapshot to give you a feel for the sorts of things we're looking at. And in some respects, these figures are really perhaps unsurprising for this audience. And in particular, the idea that, Black families and Hispanic families relative to white families did experience not only higher levels of unemployment, but the reduction in unemployment was in particular quite a bit slower throughout the summer and into the fall. And also importantly, there's been this emphasis on trying to think about the difference between frontline and non-frontline. But I think one of the points of our findings are simply that these distinctions don't take away the racial gaps. In results that we don't have time to show, we're also finding that Black households are far more likely to utilize alternative financial instruments to cope. So think payday loans, selling blood plasma, overdrafting bank accounts, things like this. So even when these households are coping, they're very well more likely to be utilizing some instruments that could do all sorts of long-term harm to the financial security of the household. So this is something that we have to watch well into the future. In many respects, I think that we've already heard about the important policy implications of thinking about the COVID shock. Our point as a research team is to think hard about the idea that there are events and shocks and disruptions that occur among Black households and Hispanic households, and frankly, white households, though at a lower rate relative to Black and Hispanic households. These events are occurring within the year, and that these households importantly lack the buffers to withstand and sort of insure against these shocks. And so it just, again, emphasizes the importance of taking snapshots that are perhaps at a monthly level, or even more importantly, within the month, to understand what's happening with these families. I would also just say that I think there's great promise in making permanent many of the child allowances that are going out through the so-called American Rescue Plan. And so if that American Families Plan could be made permanent, I think there's great promise to improve the economic well-being of these families. And importantly, this is because the feature of this tax credit is that it's delivered multiple times throughout the year versus solely one time right around tax filing time, which by the way is coming up pretty quickly. So got to get that done. So, you know, bottom line, I think that there's a lot of promise here, but I also think it's important for social work and social policy scholars to keep an eye on households and families and individuals who may be left out of the tax credits. You know, Rebecca alluded to this in her scholarship along with co-authors. Are there workers who are not filing tax credits, filing for taxes rather? Do we need better outreach to make sure that they're connected to the tax system? And also just thinking hard about many of the childless workers who received a boost in their child tax credits, or their rather EITCs, through the American Rescue Plan, but that's still far lower. And many of these so-called non-custodials are connected to families with children. So, you know, I want to close out there. It's been a fantastic conference to be able to sit through and learn from. But, you know, bottom line is that I think that this community is going to be really important in buffering against these sorts of economic risks that families experience. That goes in some instances beyond, you know, the implementation of income transfers, but also the sorts of wraparound services that can really address the events that basically take place when families experience so-called income volatility, shocks to housing, shocks to transportation. So, you know, with that, again, just happy to be here and share a little bit of the work that I'm into, and thank you.
Okay, thank you very much. You know, I don't see a volley of questions here responding to your presentation. How questions, and perhaps it will generate some more discussion. So one of the things that I noticed particularly in your slide 5, you know, it's remarkable about the stability of these black-white differences in income and wealth over time. But I noticed in looking at your chart about income volatility that it too doesn't seem to be very responsive to anything that would represent the business cycle. So I look at your data, so you removed it from me, but it looks like after like 2003 to 2005, you get this growing increase in the income volatility ratio by race, even though they represent very traumatically different times in terms of the business cycle, with a deep recession in 2007 to 2008, and then you get you know, the Obama recovery, and then you get the Trump recovery, and yet you get nothing but up and up and up and up and up in income volatility. Can you why is that occurring, and can you think about some of the implications? If in good times and bad times income volatility continues to grow, what does that mean to you?
Sure. You know, Ron, I think it's a fantastic question, and there's a couple of points here. First of all, if we do look at pooled income volatility, that is thinking about income volatility for the broader US population, one of the things we find is that, particularly in data sets like the current population survey, yes, in fact, income volatility does rise with unemployment, right? So there is this cyclicality. Now, in the figures that I shared with the community this afternoon, one of the things that happens is that really isolating in on the black-white volatility ratio masks some of this overall cyclicality, as we would call it. And in fact, one of the things I found in my work over several years has been that really Black income volatility tends to be very elevated, and to your point, sort of consistently and almost persistently elevated. So there is this aspect when you think about the workforce conditions and labor force conditions facing Black Americans that is distinct from the overall population. And I think this has a lot to do with the precarity of work, work instability, hours instability. So it's one of these both and type stories, I think.
So I do have a number of questions, all that sort of gather around the same theme, which is the earlier panelists spoke to policies that might reduce the income differential. You're speaking about volatility. What about policies that might address this racial difference in volatility, and including your thoughts about reparations, which I know your colleagues Sandy and have spoken and thought a great deal about.
Sure. Yeah. So first off, I think that I would speak to the current battery of social welfare policies. So in work that I have co-authored with Rucha Samudra and Jordan Davis, both former students of mine at American U, we actually confirm, and it's nice to have multiple papers that do this. We confirm the result that Columbia scholar Zach Parolin confirmed, which is that, in fact, yes, states with a higher share of Blacks on the caseload seemingly provide less in the way of cash assistance. And I think this is part of a broader conversation about liquidity and providing liquidity to households. Certainly there are important non-cash aspects of welfare programs that can support families. But I certainly think that, liquidity and access to emergency liquidity is just simply very important for these households, even as a bridge prior to receiving unemployment benefits, if you qualify, right? And thinking through, programs that can do this effectively. Relatedly, I think that the within year, perhaps monthly or quarterly, quasi-quarterly aspect of these child allowances that are going out, through ARP, right, through the American Rescue Plan. I think that's going to be really important for handling some of this sort of episodic poverty, buffering against events. So, we have a policy temporarily that I think could do a lot to help families in this way. Now, I think in the long term, these sorts of within year credits need to be made permanent. Now, I think this could have all sorts of great implications for Black families. I believe Rebecca Charles's work, along with co-authors, suggests that there's going to have to be more outreach to make sure Black families are adequately attached to the tax system. On the matter of reparations, I think it's something that has to be studied and looked at carefully. I've learned quite a bit from my co-authors, Sandy Darity and Derek Hamilton, on the matter. And I think that this is going to take a deeper dive into thinking about the broader battery of supports, expensive access to housing, wealth promotion. What will it take to really level the playing field after hundreds and hundreds of years of deliberately damaging policies and programs against Black Americans?
Thank you, Bradley. There's a question here regarding the relationship between work in the gig economy on the one hand and the volatility that your data speak to. What is your thinking about that? And in terms of policy, how do you think about the proportion of people of color who are in the gig economy on the one hand, and the income volatility, which may be in part a consequence?
No, it's a great question. I mean, I think, look, this is where the research is headed to try to understand the role of, contract workers, contingent workers, and, the emergence of this workforce in driving income volatility. I can tell you that in a related set of findings, I, along with Michael Carr at UMass Boston, we've been looking into some of the drivers, sort of decomposing what's causing income volatility by race and gender. And one of the things we find, and in particular for Black males, is that this volatility in many instances is caused by, again, this really important aspect of going in and out of work altogether and changes in hours, right? Mm-hmm. And so we don't necessarily know in that data whether or not that is due to, say, working in the contingent workforce, working as a contract worker, and you can think about the examples, but we think it's certainly consistent. And so, I think my prior rather is that this is certainly a culprit. I think it's also why when we think about well-being, we have to triangulate. Part of the theme of my work here with my co-authors is you need multiple measures to try to understand economic well-being. Likewise, if we sort of stop the conversation at employment, we probably missed the mark in terms of thinking about the quality of that employment, the level of earnings, benefit package around it, and then the stability of those earnings.
Yeah, so if I could comment a bit as well.
Yep.
Rob Hartley and I, another member of the team,
Yep.
have been thinking about unemployment insurance in this regard, and the way in which unemployment insurance, because it doesn't provide an on-ramp to unemployment insurance for people who are heavily engaged in the gig economy. This is one policy that may well need correction, given the large proportion of low-wage workers generally and people of color in particular who are in the gig economy and who experience this volatility of work, but for which unemployment insurance doesn't provide any protection, particularly in periods in which people are laid off and looking for a road back to their stable job. So I also have a question here alluding to, let me try to rephrase it. Was asking, what impact do you feel that this income volatility may have on young people and their proclivity to be involved in gangs as opposed to the labor force? I mean, one way in which I think about this particular question is, we do know that there's mass incarceration, the large volume of people of color, particularly men of color, who have been incarcerated, which makes getting a stable job very difficult. Do you think there's a connection there between incarceration, income volatility, and the options available for people of color, particularly men?
Well, so Ron, this is a really interesting question. And I actually view this, one way of viewing this is in an intergenerational context. Mm-hmm. So thinking about the conditions that children face during their developmental years. Now, in some ways, this is beyond the scope of the work that I've done thinking about kind of the developmental context, but there is great work showing, frankly, that exposure to trauma, exposure to just broader household instability, that can lead to contact with the criminal justice system, greater likelihoods of exposure to violence. And so you could think about, the idea that in some respects, these really are summary measures: income, wealth, income volatility. Well, you really want to get up under the hood, metaphorically, to think about what's happening in the lives of these households, right? And so I think in that regard, it may not necessarily be the income volatility itself alone that might lead to some of these social phenomenon, or violence with community level violence phenomenon. But what I do think is that income volatility could be almost like a marker or a signal for all sorts of instability that's occurring at that household level. And so, we know in this literature, there's new evidence showing that exposure to income volatility during childhood does lead to higher incidence of mental health challenges, mental health problems in adulthood. So I think that there could be a link there. And, I think this is where the work is ongoing. Some of this work thinking about exposure to income volatility and mental health outcomes is actually fairly hot off the press. I know there's a great work in social forces, for example, that's profiling some of this work. So I think that there's potentially a link there, and one that we're going to have to keep an eye on.
Excellent. Okay, seeing not another question, and seeing that we have 3 minutes, Chris, I might hand it back to you. Thank you, Bradley, so much for adding significantly to our conversation.
Good to be here.
Thank you, Dr. Hardy, Dr. Mincy, for a great conversation. And I'm just here to close the day, and mostly want to say thank you to all the people on the agenda for sharing your time and your comments and your research. And want to especially thank Sonia Hawk, Barbara Lance, and the School of Social Work, all for their support in making the event happen and helping with all the outreach and logistics and all the things going on behind the scenes. And especially thank you to everybody in the audience for showing up and participating and sharing your questions. And we look forward to seeing you next year and hope everyone has a great day. Thanks, everybody.